Welcome to the deep dive. Today we're tackling a really interesting topic in dog health, hyperestrogenism.
Hmm.
So basically, this is when dogs, and it can be males or females, have, unusually high levels of estrogen.
Right.
It's kind of a complex picture, and, well, understanding it might actually explain some surprising things you might see in your own dog.
Absolutely. Yeah, we've been digging into some excerpts from a pretty detailed medical text on how it's diagnosed and treated. It's definitely dense, but our goal here is really to pull out the key stuff,
Mm,
what causes it, what signs should you look out for, and what does it actually mean for dogs.
right. Trying to make it clear, useful, without, drowning everyone in jargon.
Exactly.
Yeah.
Actionable knowledge, hopefully.
Okay, so let's jump right in. Hyperestrogenism, what is it, sort of in simple terms?
Okay, so really it boils down to a dog having too much estrogen in their system.
Yeah.
We're talking specifically about hormones like estradiol, estriol, or estrone.
Mm.
And this extra estrogen, it doesn't just like appear randomly.
Yeah.
There are basically two main paths this can happen.
Yeah, all right. Lay 'em on us. Where's it coming from?
So the first way is what we call endogenous. That just means the dog's own body is making too much estrogen.
Okay, internal production gone wrong.
Yeah. And the second is exogenous, meaning the dog gets exposed to estrogen from, an outside source.
Okay, that makes sense. Sometimes our own bodies go a bit haywire, and then there's definitely stuff in the environment too. Now, estrogen, we usually think of that mainly with females, right?
We do, and it's definitely vital for, sexual behavior and the reproductive tract in females. But interestingly, estrogens also play roles in males.
Oh.
Yeah, they're important for how Leydig cells function. Those are the ones making testosterone. But estrogen's reach goes further in both sexes.
How so?
Well, it affects the lining of the uterus, the cervix, the prostate gland in males, even bone strength. It helps build bone and hang on to calcium and phosphorus. And it also plays a part in overall protein levels and how the body uses energy.
Wow, okay, so much broader than just reproduction. And when those levels get too high, that's where the trouble starts.
Precisely. When estrogen gets too high, it sort of trips this feedback loop in the brain.
Like a thermostat.
Kind of, yeah. The brain senses the high levels and tries to dial back the signals hormones, called gonadotropins, that tell the ovaries or testes to make estrogen.
Okay.
But here's a key thing. Too much estrogen can also directly interfere with the bone marrow's ability to make new blood cells.
Oh, wow.
And it can even affect how the body uses iron, which you need for red blood cells.
That sounds pretty serious. Okay, so let's tackle the first type, endogenous, where the dog's body is the source. Who usually gets this?
We tend to see this one more often in older male dogs, and frequently it's linked to functional testicular tumors.
Functional, meaning they're actually producing hormones.
Exactly. They're not just sitting there, they're churning out hormones, including estrogen. In older female dogs, it can come from granulosa cell tumors or other ovarian tumors that are functional, or from these things called follicular ovarian cysts, like little fluid-filled sacs on the ovaries.
Okay,
And interestingly, younger female dogs can also get it from those same follicular cysts.
got it. So it really sounds like growths, tumors, or cysts on the reproductive organs are the main culprits when the body itself is overproducing.
That's a good summary.
Yeah.
Yeah, specifically those follicular ovarian cysts, then the functional ovarian tumors like granulosa cell tumors you mentioned.
Mm-hmm.
And for the males, various testicular tumors can do it. Sertoli cell tumors are kind of the classic example known for estrogen production, but Leydig and interstitial cell tumors can be involved too.
Okay, now let's flip to the other side. Exogenous hyperestrogenism, external sources. How are dogs getting exposed?
Yeah, and this one, it could hit any dog. Breed, gender, age, doesn't matter because it's all about the exposure. And here's the thing the text really highlighted that might surprise people, especially if you have smaller dogs. They seem to be at a higher risk if someone in the house uses transdermal human hormone replacement therapy.
You mean like creams or patches?
Exactly. Because they're small, maybe held close a lot, they can actually absorb these hormones right through their skin from contact with the person using them.
Wow. That's probably not something most people would even think about.
Probably not. It seems like such a small thing, but it can have real health effects for the dog.
Okay, that's really crucial info. Are there other external routes?
Yes, the text mentions iatrogenic causes. That just means it happens as a result of medical treatment.
Nah. Okay.
So maybe certain medications used in the past, though less common now. Or sometimes a vet might use an estrogen preparation for a specific treatment purpose.
Gotcha. Okay, so we've got a handle on what it is and the two main ways it happens. Now, what about the signs? What are the red flags that might make you suspect this?
Okay, so there are a few things, like looking back at the dog's history, and then things a vet might pick up on exam.
Let's start with the history. What might owners notice?
Well, for a female dog, she might suddenly become really attractive to intact male dogs, even when she's not supposed to be in heat.
Interesting.
Infertility can pop up in both males and females. Females might have heat cycles that are like way too long or happen too often, or even show signs of nymphomania, basically excessive sexual drive.
Okay.
You might also see the vulva swelling up or some bleeding, which leads to the dog licking that area a lot.
Right.
And then there are less common, but, more serious signs, potentially.
Right.
Nosebleeds, blood in the urine, just being really lethargic, maybe a fever.
A fever, why?
That could signal an infection, possibly because the high estrogen has weakened the immune system, like affecting white blood cell counts, and signs of anemia, too.
Okay, quite a mix there. And what might a vet see during the actual physical exam?
Looking at the skin, a really classic sign is non-itchy symmetrical hair loss.
Mm,
So losing hair evenly on both sides, but they're not scratching at it. Sometimes the skin underneath gets darker, too.
okay.
In male dogs, the vet might feel a lump in one or both testicles or notice their different sizes. Or sometimes the testicles actually shrink.
Hmm.
And it's important to know if there's a history of undescended testicles, because tumors can develop there, too.
Right.
You might also see an enlarged prostate gland or even breast tissue development in males. That's called gynecomastia.
Breast tissue in male dogs. Wow.
Yeah. And in really advanced cases, a tumor can pretty much take over the whole testicle.
And for female dogs, what are the physical findings?
Well, you might see that swollen vulva we mentioned, maybe some vaginal discharge, and like the males, they can also develop breast tissue.
Okay.
Then looking more systemically, like at the blood and immune system, maybe pale gums if they're anemic, tiny little red spots on the skin or gums called petechiae.
Like little pinpoint bruises.
Exactly. Fever again if there's infection secondary to low white cells,
Yeah.
and just generally seeming depressed or unwell.
It definitely sounds like some of those signs could overlap with other conditions. So how do vets figure out if it is hyperestrogenism and not something else?
Yeah, good point. Diagnosis isn't always simple. It really involves considering other things that cause similar signs, differential diagnosis, they call it.
Right.
So that non-itchy symmetrical hair loss. That could also be hypothyroidism or Cushing's disease, or maybe this thing called GH-responsive dermatosis.
So how do they tell the difference?
Usually through blood tests and looking at the whole clinical picture. Like with hypothyroidism, you check thyroid hormone levels, cholesterol might be high. Cushing's often has increased thirst, urination, specific changes in cortisol tests.
Okay, so other clues help narrow it down. What about that thing with female dogs attracting males when they shouldn't?
Right. While that's a clue for hyperestrogenism, it could also be something simpler like vaginitis or maybe just inflammation around the vulva or even a UTI causing irritation.
So how do you check that?
A key tool there is often vaginal cytology. The vet looks at cells from the vagina under a microscope.
Aha.
With hyperestrogenism, you'd expect to see lots of specific superficial cells. That picture would look different from just, say, inflammation or infection. Plus, checking if the dog was spayed or looking for ovarian issues helps.
Makes sense. And if a male dog is infertile, what else could be going on?
Yeah, the text lists a few possibilities there, too. Things like testicular degeneration shrinking testicles, or immune problems hitting the testes, even intersex conditions.
So how do they investigate that?
It starts with a good physical exam, feeling for any masses in the testicles or even up in the abdomen. Then a semen analysis is really important. Check the sperm count, quality, all that. And sometimes they might need to do a fine needle aspirate or even a biopsy of the testicle.
Okay, so it's a real process of elimination and pattern recognition. What about specific lab tests for hyperestrogenism itself?
Right, so tests are obviously key. The text points out that routine blood work, like a CBC, can be a bit variable, especially early on.
How so?
You might see some initial changes in platelets or white blood cells. Anemia might show up later. In really severe, long-standing cases, you can get pancytopenia, where all blood cells are low, or even aplastic anemia, where the bone marrow basically shuts down.
Wow.
But it's also mentioned that often the standard blood chemistry panel in a urinalysis might look completely normal.
Huh. So routine bloods might not scream hyperestrogenism.
Not always, no. They can give hints, but specific blood tests to actually measure estrogen levels, especially estradiol, can be done.
Ah,
But, and this is important, the text notes that sometimes normal estrogen levels can overlap with the range seen in this condition just due to test sensitivity.
so a normal level doesn't completely rule it out?
Not necessarily. What's often more significant than just one high number is seeing that estradiol levels stay high, like at the level you'd see when a female dog is in heat, but for a prolonged period, like more than 30 days or so.
Okay, so sustained elevation is more telling. What other tests are really useful then?
Vaginal cytology in females, or preputial cytology in males, is highlighted as being pretty reliable
Why is that?
because estrogen directly affects those tissues. So looking at the cells under the microscope, you see a characteristic picture, lots of those superficial epithelial cells, often without a nucleus or just a tiny one. That cell pattern strongly suggests high estrogen influence.
Got it.
Imaging is also super helpful. Abdominal ultrasound, especially. You can look right at the testicles for masses, the ovaries for cysts or tumors, check the prostate size. Ultrasound can also show if nearby lymph nodes look abnormal.
Okay.
And sometimes a vet might use a tiny camera for vaginoscopy to actually look inside the vagina.
And if they do suspect a tumor?
Then getting a tissue sample is usually the next step.
Yeah.
A fine needle aspirate of a testicular mass can sometimes give a clue by looking at the cells.
Right.
But for a definite diagnosis, especially for ovarian issues or testicular tumors, and to see if it's malignant, you generally need a biopsy.
Mm-hmm.
And if cancer is a concern, chest x-rays are usually done before any surgery, just to check if it might have spread. Oh, and if the blood work suggests bone marrow problems, a bone marrow biopsy can confirm that suppression.
Okay, so a thorough workup. If a dog is diagnosed, what's the treatment plan usually look like?
Well, for the endogenous kind, where the body's making too much from those tumors or cysts, the primary treatment is generally surgical neutering.
So spay or neuter surgery?
Exactly. Orchiectomy for males, removing both testicles. Ovariohysterectomy for females, removing ovaries and uterus. Or sometimes just an ovarectomy, taking only the ovaries. And the outlook, the prognosis, is usually pretty good if they can get all that affected tissue out.
What if the dog is, say, a valuable breeding animal? Are there any other options?
The text does mention that in very specific situations, maybe doing a unilateral surgery, just removing the one affected testicle or ovary might be considered. But, and it's a big but, you have to realize that being exposed to high estrogen for a while can cause lasting changes in the other reproductive organs too. So future fertility isn't guaranteed.
Ah.
And it specifically mentions that using testicular prosthetics is not recommended and ethically questionable.
Right. Okay, so surgery is usually the way for endogenous cases. What about exogenous, the external exposure kind?
Right. So for that one, it's really about finding and stopping the exposure. Like we talked about, being super careful with those human transdermal hormone therapies at home, especially with small dogs.
Yeah, that seems key.
Definitely. And if a spayed female is on estrogen for, say, urinary incontinence, the vet might need to adjust the dose or maybe stop it entirely. The good news here is the prognosis is usually excellent once that source is removed.
That's good to hear. Is there anything else done to, like, support the dog through treatment?
Yeah, supportive care can be really important, especially if there's significant bone marrow suppression causing anemia or risk of infection.
Like what kind of care?
Well, antibiotics if there's a secondary infection.
Mm.
Maybe blood transfusions if the anemia is severe. There are also some medications like synthetic erythropoietin that can help stimulate red blood cell production and similar drugs for white cells.
Okay.
But the text does caution about using chemotherapy for any underlying tumors if the bone marrow is already really suppressed from the estrogen. That could make things worse.
Right. Tricky situation.
Yeah. In those cases, consulting with a veterinary oncologist is probably the way to go.
So after treatment, say after surgery, what should owners expect? What's the recovery look like?
If bone marrow suppression was a problem, then follow-up blood tests are crucial to make sure those cell counts are coming back up.
Okay.
For male dogs who had a tumor removed, those signs of feminization, like the breast tissue development, should start to get better within about, say, 2 to 6 weeks.
That's relatively quick.
It can be. But here's a serious note. If those blood cell counts don't start recovering within a few weeks after removing the source, the ovaries, tests, cysts, that's unfortunately often a poor sign. It suggests the bone marrow damage might be too severe.
Okay, that's important to know. Wow, okay, so that was a lot, but a really clear breakdown of a complex issue. To kind of wrap it up, what are the main things you hope people take away from this deep dive on canine hyperestrogenism?
Yeah, I think the big takeaways are, one, it's about abnormally high estrogen. Two, it can come from inside the dog's body,
Mm.
often tumors or cysts or from outside exposure.
Right.
Three, the signs can be really varied, affecting reproduction, skin, even blood cells. Four, diagnosis means looking at the whole picture, ruling things out, and using specific tests like hormone levels and cytology.
Mm-hmm.
And five, treatment usually involves fixing the source, often surgery for internal causes or stopping exposure for external ones. And getting veterinary help early if you see signs is really key.
Absolutely. And maybe just one last thought to leave everyone with. Maybe just consider, the subtle ways things in our homes or even actions we think are harmless could potentially affect our pet's hormone balance.
That's a great point.
It just underscores how important it is to be observant, stay informed, and, talk to your vet if you notice anything unusual with your furry companions. Thanks for digging into this with us today.
My pleasure. It's important stuff.